We're joined now by Dr. Georges Benjamin. He's the Executive Director of the American Public Health Association here in Washington. And Dr. Benjamin, I just want to get your take on how a number of these countries, we just saw that report from Russia, also Denmark and Sweden, are either implementing some sort of passport or vaccination certification or have already done so. What is your take on it? Is this a good idea?
You know, they're highly controversial, and the reason they are is because they don't necessarily guarantee that you're disease-free. Now, it's not unusual for people to require documentation for vaccination when you're going into an endemic area to try to protect yourself. Yellow fever is a great example of that, or hepatitis is another example. But we just don't know enough about what the vaccination does to protect you, or even what a positive antibody test or even a COVID test tells you about whether or not you're going to be infected or not going into another country.
And I think another big question is, like, how often would you have to renew this passport or certification, depending, as you mentioned, how long the vaccine immunity will last?
We don't know anything about the periodicity of having to document the paperwork. And then, of course, there's the black market. You know, anytime you create a rule like that, somebody's going to figure out how to craft fraudulent papers, and then people who have money will be able to just bypass the system.
What about countries, forgive me, let me change my question here. What about the fact that it's not just countries that want to implement some of these policies, but airlines? Is this going to make, I know you're a doctor, sir, but still, looking at what we're dealing with, do you think that's going to make travel simpler or more complicated during a pandemic?
It's going to certainly make it a lot more complicated during the pandemic. Right now, if you want to go on vacation, you've got to get a test within about, 72 hours. You've got to document that. You've got to go on a website. You've got to enter the information. It's already a very onerous process. And I'm not quite sure that we get the safety that we think we're going to get from that process.
Talk about the privacy and data sharing. How do you balance this type of certification with not wanting people to know your medical background?
Well, it's significant, particularly if you're someone who has a medical condition for which you cannot be vaccinated. Then you're, for all practical purposes, either prohibited from traveling, or you have to show them some other kind of documentation about your medical condition, which you may not want to share.
And what would you advise to travelers who have been vaccinated and do want to travel?
Well, I think that we should always wear a mask, wash our hands, and keep our distance, follow those good, sound public health practices, and we're going to reduce our risks. Tragically, until we get rid of this pandemic, life is not going to be risk-free, but we can dramatically reduce our risks with good public health measures. And I do encourage people to get vaccinated.
And just to be clear, if you've been vaccinated doesn't mean you can't possibly get other people sick. It could still be a carrier.
That's correct. You still need to wear a mask. And so it does, getting vaccination absolutely prevents you from dying and getting really sick, and that's a wonderful thing. But we don't know enough about the transmission aspects of vaccination, not yet, so you still have to wear a mask.
Wear those masks and wash your hands and keep your distance. Dr. Georges Benjamin, thank you very much.